All right, you tell me. Got it. Recording in process. Okay. Hello, everyone. Thank you. Thank you for also bearing with me. I am working on the road today. I dropped my kid off at college down south, and I will do the best I can to look at my small screen with my old eyes to follow the PowerPoint that I put together for today. So, thank you. So what we're going to talk about today is basically an evidence for and encouragement to make sure that we, as much as possible, utilize our mutual support groups, 12-step programs in our communities as a way to engage our patients for whole person, comprehensive and successful care. All right, can you advance, please? There we go. Dr. Bob and Bill W. are two guys who, back in the 1930s, found each other after unsuccessfully on their own trying to quit drinking. And they became part of a larger group that came to be Alcoholics Anonymous. But what they learned was a number of principles, but foundationally, that if they stuck together and helped others, then that would, they saw success in ways that they didn't see otherwise. And it grew into a international movement that has over, well, almost 100 years now of participation and involvement across the globe. Next. All right. So it's got worldwide membership, as I spoke to. Almost anywhere in the world now has a Alcoholics Anonymous or other 12-step program. It's a basis for other recovery organizations like Narcotics Anonymous, Smart Recovery, and other groups. In 1951, the Alcoholics Anonymous won the Lasker Award from the American Public Health Association as one of the most influential and impactful public health efforts in society, in American society. Henry Kissinger, politician, for many, many years, many, many decades, said that America's gifts to the world, that Alcoholics Anonymous was America's gift to the world. The Big Book, which is the primary text for Alcoholics Anonymous, written in 1939, is among 88 books that have, quote, shaped America in the United States Library of Congress. Now that we're on our 250th anniversary, this is very good history from an American standpoint. Next. All right, so here you see a picture. That's a well-known portrait in Alcoholics Anonymous lore. I think it's called patient number 3, if I remember, something like that. But basically, it's a picture here of Dr. Bob and Bill W., who were meeting with another person who was in a very what would they call it then? But it was a detox facility, but they really didn't have these very sophisticated detoxification facilities at the time. But anyway, there was a nurse who was familiar with Dr. Bob and Bill W. and what they were trying to do in the small group, and asked if they would come and care for this patient that she had in the hospital who they had very difficult time trying to get sober. And here you see them actually coming to the hospital and meeting with him in his bed in his room to try to help him stay sober. And they were successful in doing so. Next. So now, one of the great things about Alcoholics Anonymous and other 12-step programs is that you can access these anywhere in the world. So not only can you have in-person meetings, which are still foundational and the mainstay. And the other thing that's really unique about these 12-step programs is, unlike most of us who are in the clinical treatment space, these folks actually go to where the patients are and will go to their homes. But also now we can, with the advent of teleservices and the internet, you can access these anywhere in the world, any time of day. I've got patients who will log on to meetings in New Zealand, in China, in the middle of the night here, and they are able to see the commonalities of the human experience when it comes to addiction and sobriety. Has been fascinating. But anyway, long and the short of it is, this is one of those programs and services that is easily accessible, and now with technology can be accessible at the fingertips any time of day. All right, so recovery support doesn't end when treatment does, as we say, formal treatment. So formal SUD treatment episodes are brief relative to the chronic relapsing course of what we know as addiction. So most patients have structured care needing ongoing, um, no cost, available recovery infrastructure, something the healthcare system alone rarely provides. So again, this is something, these 12-step support groups are a way to provide a critical insulation for people outside the actual care episode that can support and enhance the care, again, 24 hours a day, 7 days a week. It's also free. And so if you look at the cost of treating addiction and the value that comes out of making use of these mutual support groups, John Kelly, who's some of the evidence that we'll go through, talks about there's in healthcare there isn't no such thing about there is no such thing as a free lunch, but when it comes to 12-step programs, it's the closest thing we got. 62% of U.S. adults with a lifetime drug use disorder who sought help report 12-step group participation. Around 60% of adults and adolescents in the past year who have opioid use disorder treatment report mutual help group participation. Over 2 million AA members worldwide across 125,000 plus groups. And again, it's free at the point of access. Next. So two distinct interventions. One is mutual support groups, and these are free peer-led fellowships like Alcoholics Anonymous, Narcotics Anonymous, Cocaine's Anonymous, Cannabis Anonymous, Marijuana Anonymous. But there's so many different ones for each particular addiction or substance use disorder, or even gambling and other behavioral addictions, or a combination of all. So there's just a potpourri, if you will, of groups that are out there that people can make use of. They're voluntary in the community, and they exist independently of formal treatment. So those are the mutual support groups. And then there's something that's actually an evidence-based, manualized treatment that you as a clinician can engage in, that has been well researched. And this can be done as an individual or a group, but it actively links patients to these 12-step programs. So in and of itself, it's not AA, it's evidence-based. So, one way to think about this is on a spectrum, that you can be all in on 12-step facilitation as a manual-based treatment program that you can actually implement in your clinic, for instance. And that requires becoming familiar with the manual, and you go through that with your clients or with your patients. So that's one way that you can try to engage people. But another way is simply actively asking people, patients that you have, about their participation. And so referring folks, knowing which groups are in the community, referring specifically your patients to these groups. And then when they come back, you ask them about it. What have you learned about it? How are you working with your sponsor? Do you have a sponsor? Which group do you go? Do you have a home group? Have you started working on the steps? And so there's really a spectrum of active participation that you as the clinician can engage in when it comes to utilizing these support groups. Next. All right, so I'm going to review for you the most comprehensive meta-analysis that to date that looks at the evidence for AA and 12-step facilitation. And this is by John Kelly, who's out on the East Coast. and then Keith Humphreys. Both of these guys are very well respected, and Keith Humphreys is out at Stanford, but he's a native West Virginian. Great guy. He's come and spoken at our Addiction Training Institute, and also has testified before the West Virginia state legislators and then also United States legislators. So he is really at the top of his game. And so these are two of the most important researchers when it comes to looking at the evidence behind recovery capital, and also 12-step facilitation mutual support groups. So this meta-analysis looked at 27 primary studies with over 10,000 participants. 21 of these studies were randomized controlled trials, and 3 years of follow-up of data captured. Next. So what are the outcomes? And the outcomes on abstinence are the most robust. So the proportion of patients completely abstinent in the 16 studies, percent days abstinent, and we're going to go through all of this as well. The longest period of abstinence. So these are the outcomes that are being measured. So abstinence, a whole bucket of abstinence. Drinking intensity, the drinking days per day, percent days heavy drinking. And again, these are the various studies that were used in these meta-analysis and what types of outcomes. So abstinence being one, drinking intensity being another. Alcohol-related consequences, 8 of the studies took a look at those outcomes. Alcohol addiction severity, 7 of the studies did. And then economic analysis, 4 of the studies did. You can see each of the ends, each of the numbers there if you're interested. Next. All right. And so you could look at the basically what this graph shows is the comparison between 12-step facilitation in the blue column compared to the other possible treatments in the study. And then you could see that's like too small for me to read, but you can see that the 12-step facilitation and all of those studies outperformed the alternatives, and certainly wasn't worse. Next. Thank you. So here we go. Alcoholics Anonymous and 12-step facilitation outperforms the other treatments on outcome. This differentiating itself from at 12 months, 24 months, 36 months. Next. And reduces healthcare costs while improving outcomes. So 4 of the 5 economic studies in the Cochrane Review found a substantial cost-saving benefit over comparison treatments. And 4 out of 5, let's see, economic studies found that they produce substantial healthcare savings. 1 million people treated annually for AUD in the United States alone, the scale of which the savings combines. And then, lost mine for a second, thank you. 10 billion plus in savings in the United States by making use of our 12-step facilitation and mutual support groups. Again, that's where John Kelly says this is the closest thing we got to a free lunch in healthcare. Next. All right, so this is basically a slide that just shows the strength of the evidence based on the grade certainty. You can look at that slide for yourself. We'll have those, but basically you can see this is very strong as far as the strength of evidence, especially for abstinence. Next. So other outcomes that have been demonstrated within these studies, the meta-analysis, and then other studies that have subsequently been done. So reducing depression, and so people who are participating in mutual support groups have reduced depression, report reduced anxiety, increased meaning in life, and then stronger intimate relationships. Next. So what's the mechanism behind these outcomes? So one is that it provides a change in their social network, and I'm sure all of you who have been working with folks who find themselves in addiction know, and you've heard people, places, and things. So definitely the people that we spend time with is going to have an impact and an influence on our behaviors. And many folks, unfortunately, who find themselves in an addiction problem have spent time with people who are in the midst of addiction themselves and have not been very healthy environment for those who are seeking help. And so this is actually participating in AA, NA, and the like provides a new social network uh, where it's actually incumbent as part of the culture that people are trying to work on healthy behaviors. Also, abstinence as self-efficacy, so increases confidence and the ability to resist use across high-risk situations. So, one of the things we see over and over again is that people who faithfully, routinely, regularly go to these groups, they see other people, they see their peers getting better, and they see what life looks like when they make these changes. And then it gives them the hope that, well, you know what, if this person can do it, I can too. And they continue to practice and come back to the group and get the support and the encouragement for what they're doing. Reduces negative affect. Talked about how actually one of the beneficial side effects of these group participation is lowering depressive symptoms, anxiety symptoms, especially among those who are severely mentally ill and chronically mentally ill, and many of our patients are potential diagnosis. Also, one of the main features that is consistent with a improvement in these outcomes is a spiritual experience of working through the steps, and that is a contributor where people are able to contribute meaningfully. It's not required for the benefits overall, but it does seem to be one of those areas that is associated as a driver of success, abstinence, in depression, etc. Next. All right, and so what's important in this slide is to make sure everybody knows the most robust evidence that we have regarding mutual support groups is with Alcoholics Anonymous, and so that's the longest running group, but also the one that's um, um, most popular and prevalent across the world, and it's also the one that's been studied the most. So the other substance use disorders, they do not have the same type of evidence, but that evidence base is growing. Narcotics Anonymous and related fellowships. So, was that 60 to 62% of individuals in the past year, opioid or drug use disorder treatment report participating in 12-step mutual support groups. Retention with medication treatment. So this is interesting that those who are participating in NA attendance associated, there's some studies that really demonstrate positively that it's associated with longer treatment retention and does not necessarily impede people remaining on MOUD, especially buprenorphine. Um, like I said, it's also a growing evidence base. Next. Okay, why clinicians often worry, or what clinicians often worry about, and what the data actually says. So, one isn't it just a spiritual program? It won't fit every patient. And the research shows benefit is carried mainly by the social, cognitive, and affective mechanisms. Spirituality matters for a subset, like I mentioned earlier, and does seem to be an important driver in many patients, but it's not a requirement for improvement. And what your patients will tell you as well is that if somebody is not identify as a spiritual person or as a religious person, that they should still be able to participate in these programs. That a higher power, for instance, is not necessarily in the 12-step speak, have to be a god of a particular religion. So mutual support groups competes with medication treatment. So studies of buprenorphine patients, so mutual help attendance does not impede medication treatment and may enhance retention and outcomes when combined. But yeah, I do say, this has kind of changed over the years when, back in the early 2000s, mid 2000s, when we started using buprenorphine for many of our patients, and sort of built up the COAT program. It seemed like early on, none of the NA groups had a problem with it. But then as more and more people became familiar with the medication, as there were instances of diversion and sort of misuse of the medication, then you did see the stigma that became relatively prevalent within our 12-step communities in the area. But that over time has also improved. So you got to be careful too about which meeting, and you kind of learn from that from patients. Referral alone should be enough. So it's not just, hey, telling your patient, hey, you know what, it'd be a good idea to go to 12-step meetings and then end it at that. But there's strong evidence base for both the manualized 12-step facilitation, but also making sure that you are following up and actually curious and inquiring about their participation. What are they learning? Again, learning what the programs are actually doing, what a sponsor means, what it means to go through the steps, finding out what steps they're on. How much are they actually doing? It's typically recommended 90 meetings in 90 days for somebody to truly get engaged, and that's what I always try to recommend. But know that not everyone's going to do that. Next. All right. So what can you do? Implementing mutual support groups in the clinical pathway. One is screen and introduce. So introduce mutual support groups as a standard expected element of the recovery plan. So making it as normalized as possible and as operationalized as possible for every patient. And again, that means screening every patient. Are you participating in a 12-step program or an alternative mutual support group? If not, why not? What's been your experience in the past, and what do you think about trying to participate now in the future? Facilitate, don't just refer. So we already mentioned this a couple of times. Support early engagement. Help patients find a compatible meeting format, and where relevant, secure a sponsor during the first weeks. So that's really important for people to maintain that connection and have some degree of help and accountability. So I try to tell my patients, go early on, look for somebody early on that seems to have the type of recovery that you would like to have, and ask them if they would be willing to be a sponsor, even a temporary sponsor. Integrate with medications and other care. So help patients so pair with pharmacotherapy and other evidence-based treatments rather than positioning it as an alternative. So I think that's really key, is really looking at this as a part of your whole treatment recommendation and plan. And it's not a question of either or, but it can be both and track participation over time. So monitor attendance, have a formal way to monitor attendance and engagement longitudinally, and look at sustained participation. Not a single referral drives the outcomes. Next. All right, so the case in brief. So the Cochrane level, high level certainty shows that mutual support groups improves continuous abstinence beyond other established treatments that last even 36 months that they've actually looked at the data to examine. Alcoholics Anonymous 12-step facilitation performs as well as other active treatments on drinking intensity and related outcomes with no evidence of harm. They're also associated with substantial healthcare cost savings. And benefit is driven by identifiable, replicable mechanisms, social network change, self-efficacy, and affect regulation. Active clinical facilitation is what the evidence actually supports. Next. And there's the references that you can all have available. And next. And so that ends the presentation. I will also end the talk with speaking about Carl Jung, who many of you know was a very instrumental psychotherapist that has affected our field quite substantially. And he actually had a really good correspondence with Bill W., one of the founders of Alcoholics Anonymous. So Carl Jung had tried treating a number of people who had alcohol use disorder. Of course, they called it alcoholism at the time, but alcohol use disorder, dipsomania, was one of the earlier terms for it. And found that Carl Jung found that unlike other psychiatric illnesses, that he just did not have any success in treating folks with alcohol use disorder. And so he had one of his patients who got connected with AA and Bill W., and he actually got better. And so he became very impressed with Bill W., Alcoholics Anonymous. And one of the lines that I really like that Carl Jung said about what makes this work is that it's the protective wall of human community. And I think that is one of the dynamite features about mutual support groups, is the connections that are being made with other people, and how impactful that is in sustaining recovery over the long term. So that is the end of my formal didactic here, and I'm happy to entertain questions or engage in discussion.